All right, folks, welcome back to the program. Thanks so much for being with us today. Okay, joining us, we still have Nic Horton with us from the ArkansasProject.com and the Advance Arkansas Institute. Nic, are you there, sir?
I'm with you. How's it going?
All right, so we're talking about Medicaid expansion. It's not. I mean, it's going better. I had some time to kind of regroup and not be such a whiny baby about how frustrated I am. So what's the other aspect of this? You know, we're talking about accounting gimmicks, things like that.
Well, look, I mean, I think there's a very real possibility that, you know, Republican lawmakers sort of found what they were looking for here. I mean, they went to DHS, they requested a study, and they requested a study that was going to show how much money that their private option model would save the state, and they got it. That when they go out and talk in the media and talk on talk shows like yours, they don't have to explain to people that private model is not going to save us money compared to doing nothing. They just operate under the assumption that it's going to save us money compared to doing full expansion. And that apparently is, based on a lot of comments that I've seen from Speaker Carter and a few others in the media since this report came out, that's apparently all the evidence that they need to go forward with this plan. And I don't, you know,
So I guess the question is, Nic, we don't know why we can't get legislators to acknowledge that doing nothing is a legitimate option, I guess. I mean, we don't know why. You mentioned them about reforms, or maybe there's been some deal-making, or maybe it's because they know that the liberal press in Arkansas is going to say, you know, we can't believe that you guys are don't want children to have health insurance. I mean, but that's the main question. Why are they going out and saying we're going to save the state hundreds of millions of dollars, but when you throw it in their face that it actually we can save the state $1 billion if we just do nothing, they don't seem to, that doesn't register with them.
Right, and perhaps this goes back to the fact that we just don't know what this plan is really going to look like. I mean, there's still nothing in writing. There's still nothing, at least that we know of, in writing.
Well,
nothing that's been
released. I know the legislators have some things in writing, but it's not anything that's been released. I know that for a fact.
Right. There is no, at least as of Tuesday, when Senator Sanders spoke to the group at the Capitol, there was no agreement between the state and the feds as to what this program could look like, what the feds would allow Arkansas to do within sort of this framework that they've given. So there was no agreement in writing. Until there's agreement in writing, there can't be really much of a plan in writing until the state knows what the feds will actually let them do and has something to hold them accountable with. But again, we've been left in the dark. All of this is going on behind closed doors. The plans have not been released. And so perhaps Senator Lamoureux and some of these others are right. Perhaps I'm completely wrong. Perhaps doing nothing is not a conservative option because they're going to come out with some sort of plan that is going to just completely topple Obamacare, and it's going to reform Medicaid to where, it's going to save us all this money and all these things. But based on what we know right now, doing something is going to cost us about $1 billion more over the next 10 years than doing nothing. And how are we going to pay for that? You know, it seems to be all but forgotten fact that we have a Medicaid program that's running a deficit. We have a Medicaid program that is $61 million, according to Senator Sanders, in the red. And some people speculate, including Senator Sanders, that that number could actually be much, much higher. So we have a problem. We have a huge deficit in this program, and yet we're running into expanding that program and signing ourselves up, committing ourselves to spend close to $2 billion more into that same program, a program that's broken. How are we going to pay for that?
Well, let's talk about the government aspect. The private option they're talking about, that it's very, very generous to insurance companies. Is going to cost, like you said, $2 billion, around $2 billion over 10 years. What are we thinking? In terms of the obviously, I know the cost is a great deal, but there's in terms, I'm sorry, the federal government. The federal government is supposed to pay for this, right? So how do we know that the federal government is going to maintain that? They say that the bill provides some sort of exception in case the federal government doesn't pay what they're supposed to pay. What do you hear there?
Yeah, and that's one of the things that Senator Sanders kind of talked about on Tuesday that I hadn't previously heard. Maybe it had been reported elsewhere, but to me at least it was kind of a new wrinkle that's being floated. According to him, this is something that Arizona has done, and they've opted for the full expansion. But when they drafted their expansion legislation, they put kind of a stopgap or a fail-safe in there that said to the federal government, okay, we'll give you a little bit of wiggle room, because the federal government is supposed to reimburse 90%. The first 3 years, they pay 100% of the additional Medicaid costs. Then after 3 years, that rate goes down to 90%.
Do we even know that they're going to do that? 100%? I just got a text message from somebody that said that they heard the federal government's not even going to be able to do 100% the first 3 years.
I don't know how they're going to pay for it. I mean, they have $17 trillion in debt now, so it'll be interesting to see where they get that money. But yeah, I mean, I'm assuming, I guess we'll just print some more or borrow some more from somewhere else. But I don't know that I've heard specifically about the feds waffling in the first 3 years on that commitment. But I know for a fact, and I've reported on this previously, if folks want to go look this up, that the Obama administration, as early as 2011, and I think you and I even discussed this a few weeks ago, has already indicated that they're going to change the reimbursement rate. They can't afford it. They obviously don't care much about the promise, the commitment that they've made. And so they are already showing some serious signs. When Michael Cannon from the Cato Institute came in and said, someone said, well, is it possible that the federal government could change this reimbursement rate? He said, no, it's not possible. It's going to happen. So when that happens, these projections that we have now, this $2 billion or $1 billion over the next 10 years, they're going to skyrocket. I mean, they're just going to absolutely inflate. And how are we going to pay? I mean,
but they say
pay for this.
The Republicans in Arkansas are saying that they're crafting in that
they'll opt out.
Right, that it'll be null and void. If the federal government changes what they're going to give us, that the Medicaid expansion will be null and void in like 120 days is what it was quoted to me. So what do you think there?
I think a pretty accurate description of that is hogwash. I'm not saying that it won't be in the law, but I don't see, if Republican legislators can't hold the line right now on expanding Medicaid, don't tell me in 3 years when the federal government starts to change the deal that they're going to come in and kick off 60,000 people that they put on the Medicaid rolls and say, sorry, kids, sorry, children. And by the way, this is something Senator Sanders also enlightened me on. Part of their plan is going to be to roll back the Our Kids program, which, as you probably know, is one of Governor Huckabee's new entitlement programs that he set up to provide health insurance to poor kids in Arkansas. Mm-hmm. Well, they're going to roll back the Our Kids program and make it to where kids can just join their parents' insurance, so that any child below a certain poverty level that needs insurance coverage in the state will just join their parents' program, that and their parents are going to be covered under the new Medicaid. Well, what are we going to do in 3 years? Like you said, when the federal government breaks their commitment and they start changing those rates, what are we going to do? I mean, 3 years is not that long from now. 3 years is, a lot of these legislators will still be at the Capitol, and I don't think that they're fully thinking through the ramifications of this. What are they going to do? What are they going to do when they put 60,000 plus people on the rolls and they've eliminated Our Kids? Are they going to send poor women and children back into the uninsured area? I mean, imagine that headline. John Brahman and Max Brantley are going to have a lot of fun with that.
Yeah, and I tell you what they'll do is whoever's governor is going to call a special session and going to amend the law. And I guarantee you there won't be any kind of fail-safe in the law that they're talking about now that says it cannot be amended. In 120 days it will, they'll call a special session and they'll change the law to make sure, and we'll go along and we'll pay for it. That's what'll happen, and everybody knows it. And they're just, for the life of me, I cannot understand how they have convinced themselves that they can count on the federal government. Number two, how they have convinced themselves that they can do this, as Obamacare being as unpopular as it's ever been. I mean, it's getting more and more unpopular by the day, how they think this is actually going to be a good thing.
Absolutely, and I would like to know, I would like to hear someone explain to me, again, the details have been sort of suspect, and pinning anyone down on the details of this has been very, very difficult. But I want to know how they're going to pay for it. I want to know how they're going to pay for $1 billion to $2 billion, $2 billion of additional Medicaid spending over the next 10 years. Mm-hmm. When there's already a $60 million deficit in that program. I don't know how they're going to do it.
Yeah, and I want to know what we got to do this to get our reforms means too. I mean, there's so much stuff. Mm-hmm. Why do I feel like everything's happening behind closed doors down there in Little Rock? It's so frustrating right now.
But probably because it is.
Well, Nic Horton from the Arkansas Project. We're out of time for today, and it's 5:40, and I'm talking to you what's supposed to be an opening segment at 5. So we've had 40 minutes, folks, of discussion about this, and you need to tell everybody you can what's going on and stop the legislators from basically imposing Obamacare here in the state. Nic Horton, thearkansasproject.com. Check it out. Check out his piece right now, thearkansasproject.com. Let me look at the headline because I thought it was great. The verdict is in. Time for conservatives to abandon the private option. And that's in quotation marks because that's just a way not to say Medicaid expansion. Nick, thanks for being with us, sir.
Thanks, Paul. Enjoyed it. We'll talk to you soon.
All righty, folks, we got to go to break. We will be back in just a moment.